Hi, everyone. Welcome to Movement That Matters, exercise solutions for the top 5 common conditions I see. For those of you who know me, you know I've been creating health and rehab exercise plans to help dogs for almost 30 years now. I want to be able to share my knowledge with you and to aid in you helping as many of your patients as possible. This conversation is for those who are devoted to helping dogs live a joyful, pain-free life. It's about preventing injuries before they happen, easing discomfort with compassion, and supporting long term vitality so the dogs we love and care for can thrive at every stage of their life. To start, I'm going to walk you through some key benefits of exercise, share the top 5 conditions I see most often, and for each one, I'll give you my go to exercise along with some pro tips. Be sure to stick around until the end. I'll be offering a special opportunity to dive even deeper into this work. Targeted exercise is one of the most powerful tools we have to improve a dog's health naturally. By strengthening the muscles that stabilize the joints, we reduce the risk of injury, ease pain, and even calm anxiety. It supports weight loss while preserving muscle and lifts mood by regulating hormones. Exercise has also been shown to spark growth of new brain nerve cells and extend the life of the existing ones, helping dogs stay sharper and more vibrant longer. And all this without relying on medication. Here's why I care so deeply about teaching this work and why you can feel confident in learning from me. The truth is, this work has shaped my entire career. I opened up the first veterinary rehab clinic in 1998, designed the first underwater treadmill for dogs, and spent over a decade teaching a leading rehab certification course. I'm one of fewer than 130 veterinarians worldwide board certified in canine sports medicine and rehabilitation. And I'm still learning. I'm researching and working hands on with patients every week. My mission now is to empower you with the tools, knowledge, and confidence to make life better for the dogs you care for. When you share the wins to me, when your patients thrive and your clients light up with gratitude, it fills my heart. That's why I teach. Let's start with arthritis, one of the most common conditions we see in practice. Even without seeing clinical signs, know that 20% of dogs over 1 year old and nearly 60% of dogs by the age 4 suffer from arthritis. Targeted exercise is one of the most effective tools we have to slow this progression and reduce discomfort. When muscles and connective tissue that support the joints are weak, we get instability. That leads to inflammation, pain, and degradation. But when we build strength, we create stability. Inflammation decreases, pain subsides, and the movement improves, setting off a positive cycle. It takes 3 to 4 weeks of consistent exercise to strengthen muscle, and 3 to 4 months to strengthen tendons and ligaments. That's why we need to start now, not after the clinical signs appear. Being proactive gives our patients the best chance of lifelong comfort and mobility. This exercise is a must for every dog, especially those with arthritis. I call it cookie dance, an isometric exercise that strengthens the muscles without changing their length, making it one of the most safest and easiest ways to build stability. It's great for dogs of any age, from puppies to seniors. As the dog reaches for the cookie in different directions, it changes their center of gravity. The stabilizer muscles kick in to control the weight shifts. Feet stay planted, and the dance happens through the head and trunk. Pro tip: gently hold the collar and use a verbal cue like stay or wait to keep their feet still. You're guiding their head, neck, and body. It may take a minute to teach, but the dogs love the steady stream of treats. It feels like a game, not a workout. One more tip, and this is for all the exercises. I always teach the dog while I'm explaining it to the client, and then I coach the client once they are working with the dog. If you just try to tell the client what to do, it's kind of like asking the blind to lead the blind. Cranial Cruciate Disease doesn't happen overnight. It usually starts months or even years before the actual rupture. Inflammation inside the joint sets the stage, weakening the ligaments. Pop, pop, pop. right? They start to tear little bits at a time. That pain leads to offloading, muscle atrophy, and even more stress on the cranial cruciate ligament. Now, we can change this. We know up to 6% of labs and 0.6% of all dogs can experience a CCL rupture in their life. But we can work to lower these numbers. Our goal? Strengthen the muscles that help stabilize the knee and help support the ligament against the shear force, because that's the CCL's main job. We're not just managing damage, we're working to protect and preserve the structure before it fails. Walking over cavaletti poles is one of my favorite ways to build support around the cranial cruciate ligament. It targets the quadriceps and sartorius in front and the gastrocnemius muscle behind the knee, all crucial for stifle stability. Pro tip, if you're working on prevention, set the poles closer together and higher, between hock and knee height, to encourage full flexion of all the joints. If the dog is recovering or weak, start with them lower and further apart to make it easier. To measure proper spacing, use the dog's natural stride length. It's roughly the distance from the point of the shoulder to the floor if it's a nice, easy walk. The faster the dog goes, the further apart their stride length and the further apart the poles should be. Let's talk about hip dysplasia. Dys means not, plasia means formed. So we're talking about hips that aren't quite built right. Whether a dog is genetically predisposed, showing changes on radiographs, or already has arthritis, exercise can make a big difference in the outcome of their comfort by increasing stability. And we don't have to wait for a problem to start helping. I am all about being proactive, not just reactive. They used to say Penn hip scores couldn't change, but my friend Cindy Otto proved them wrong. After hearing how I helped my own dog, Rudy, who had hip laxity, and making it go away, she created an exercise plan for a working dog who initially failed the Penn hip. 3 months later, he passed with flying colors and tighter hips. That's why I recommend starting focused, targeted exercise early, especially in the breeds that are prone to laxity. The gluteal muscles help stabilize the hip from the outside, and the pectineus supports it from the inside. Strengthening both of these muscles helps prevent long-term damage. A few minutes a day doing these exercises well and having fun can mean less pain, fewer meds, and a lower chance of needing surgery down the road for both your patients and your own pups. Sideways walking is one of my favorite ways to strengthen the gluteal and pectineus muscles, the key hip stabilizers. There's lots of ways to teach it, but here are 2 that you might not have tried. For small dogs, try placing them on a non-slip surface, like a yoga mat, on a counter. It keeps your posture safe and makes guiding easier. For long back dogs, or those uncomfortable with you being right next to them, like some Aussies, use a tool to extend your reach, a PVC pipe, a foam stick, like I have here, even a wooden spoon. It lets you guide the movement without compromising your own biomechanics. Simple adjustments like these help both the dog and the handler stay comfortable and successful. Let's talk about obesity. It is so common, it's crazy. Over 66% of pets are now overweight or obese. And it's not just about appearance. We know there's a long list of health issues that come with extra weight: osteoarthritis, cranial cruciate ligament injuries, intervertebral disc disease, respiratory compromise, metabolic and hormonal disease like hypothyroidism and Cushing's, urinary incontinence, the list goes on. Here's something that hits home. In the lifespan study, dogs kept lean lived an average of 15% or 2 years longer than those at pet weight. Not obese, just that soft, pudgy version that many consider normal. Some cases are obvious, like this guy. But this guy's obese too. And it's our job to identify body condition score correctly and help our clients see it too. Imagine giving our patients 2 more years of a happy, healthy life. That's a goal worth working for. And put that way, our clients are much more likely to make the effort to keep their pets with them. Losing weight in a healthy manner is not just feeding less. It means recommending proper weight loss diets, paired with consistent endurance-focused exercise to burn fat and build strength. Just cutting calories, and you will lose almost as much muscle as you do fat. This isn't just about body image. It's about lifespan and health span. Let's take it a step further. Fat isn't just extra weight. It's biologically active. White fat, like the fat under the skin and around the ribs, produce inflammatory mediators. The more fat there is, the more chronic inflammation the body has to fight. These cytokines lead to tissue damage, oxidative stress, and even harm blood vessels. So when we reduce or prevent excess fat, we're not just trimming weight, we're actively protecting health and extending lifespan. The best way to reduce excess white fat? Endurance exercise. It's simple. It just takes more time than strength work. Walking, running, and especially swimming are my go-tos for weight loss. Swimming is the most efficient. Water adds up to 60 times more resistance than air. Just 5 minutes of continuous swimming can burn as many calories as 20 minutes of walking. Pro tips. If the dog's back end is underwater, they're mostly using their front legs. The more of the dog's butt that is up, the more their rear legs are engaged. Secondly, don't double their time too fast. A jump from 1 minute to 2 minutes is a 100% increase compared to from 10 minutes to 11 minutes, being just a 10% increase. Keep increases to 10 to 20% max to build endurance safely. Endurance work takes time, but the payoff in fat loss and fitness is huge. Senior frailty isn't just about aging. It's a clinical concern. It often shows up as decreased activity, muscle weakness, joint instability, or signs of cognitive decline, like canine cognitive dysfunction, CCD. CCD is a progressive neurological condition similar to dementia in people, affecting 28% of dogs by age 11 and up to 68% by age 15. But here's the key. With targeted exercise, mental stimulation, and mobility support, we can slow or even reverse this progression and keep our senior patients staying strong, safe, and engaged well into their golden years. My go-to exercise for geriatric dogs is rhythmic stabilization. It works for every dog, whether they're fragile or strong, because we control the effort by adjusting the pressure. Have the dog stand square and gently press against them, encouraging them to push back. The direction of pressure targets different muscles, and we can adapt it moment by moment based on their strength that day. Pro tip, push just enough to get resistance, but not so much that they step out. Use a cue like stay or wait, so they know they're not supposed to move. Older dogs often shift weight to their back legs. So if that's the case, avoid pushing them forward. Instead, gently pull them back to engage their rear. Simple, powerful, and safe. All right, today I've shared some of my favorite go-to exercises for common issues we see every day. But here's the thing, every dog is different. Exercise therapy isn't just about what to do. It's about when to progress, how to modify, how to make things work in real life practice. That's exactly what I dive into in Confident Canine Care Masterclass in Exercise Therapy for Every Practice, formerly called Optimum Geriatric Exercise. These exercises are designed for dogs of all ages and ability levels, from puppies to seniors to athletes. And they're meant to be practical, effective, and easy to integrate into your practice. Because when we use movement wisely, we help dogs live longer, stronger, and happier lives. Let me tell you how this course came to life. Sid came to me at just 11 months old with a long back, straight knees, and straight shoulders. I looked at him and thought, there is no way I am letting you suffer from the common injuries I see every day. Iliopsoas, back disease, cruciate disease, shoulder injuries. So I created a simple, effective exercise plan to protect his entire body before the problems ever started. Shared it with a few friends, including Laura, who lives in Chicago. Her Sheltie, Sophia, was 10 and still running agility. We worked long distance to teach her the exercises. Not long after, Laura said, I thought my dog was strong. I had no idea how much potential she had. At age 11, Sophia ranked 7th fastest Sheltie in bad dog agility, beating dogs half her age. No arthritis, no pain meds, just strong, confident movement and a long, happy life. That's when I knew this wasn't just a plan for Sid. It had to become a course. And that's how Confident Canine Care was born. Because every dog deserves that chance, whether they're aging, recovering, or still in their prime. So, who is this course for? Honestly, every veterinarian and every veterinary technician, especially the general practitioners, should have these tools. Whether you're working with a 16-week-old puppy or a 16-year-old senior, fragile dogs or high-level athletes, Confident Canine Care gives you the exact exercises you need to improve mobility, prevent injury, and support long-term strength. No rehab certification required. You'll learn how to perform and modify each exercise so it's tailored to every dog you see. And for the rehab pros, the course is going to take you deeper, refining what you already know and adding powerful new techniques that you can use right away. It's race pending for 15 hours of continuing education. This is practical, everyday therapy that you can start using tomorrow to give your patients stronger, healthier lives. So, what does Confident Canine Care look like? We start with the basics: how to spot fatigue, changes in gait, signs of overheating. Then we build step by step with 24 progressive exercises, released 4 at a time every 2 weeks. You'll learn which muscles you're targeting, when to use each exercise, when they're contraindicated, and how to know if it's being done right. And yes, the dogs do cheat. I'll show you exactly how to spot how they cheat and how to fix that problem. Each video is under 20 minutes and packed with practical tips, including how I teach my clients in real life. Follow along with just 1 to 2 hours of video every 2 weeks, and you'll build skills that you can use with every patient. Imagine having the confidence to know exactly what exercise to use, when, why, and how, whether you're working with a fragile senior or a high-energy athlete. Confident Canine Care gives you step-by-step guidance for every exercise with real dogs, so you can see exactly how to spot the mistakes and how to correct them. You'll learn exercises from both beginner and experienced dogs. That's right, I show you with both. This way you can learn how to build strength, balance, and endurance without pain, struggle, or guesswork. You won't just be learning what to do, you will learn how to think through each case, choose the right exercise, and know when it's time to level up or scale it back. Here's the key. These exercises aren't just for dogs who are already hurting. They're preventative. Start before the problems show up. Be proactive. Because the best time to protect a dog's health is before they lose it. And this course gives you the tools to do exactly that. Sign up for Confident Canine Care by July 17th and get some incredible bonuses to support your learning and make it fun. You can get Optimum Training Tips ebook to help you better understand how dogs think and learn. Tasty treat recipes your dogs and your clients' dogs will love. The Optimum Physical Therapy Fitness Workbook with guidance on training variables, stretching, and progressions. A printable exercise calendar because checking boxes helps keep us stay accountable. The Optimum Exercise Flashcard Game to make practicing the exercises even more interactive and fun. And for those who want to go deep, access to my VIP coaching lab, 7 live sessions with me where we'll walk through the exercises together and give you personal feedback on the exercises you video. Spots for the VIP lab are limited, so if that speaks to you, jump in now. Let's break it down. There are 3 ways to join Confident Canine Care, and all of them include a full year's access to the complete course. Bronze. Just need the core exercises and are short on time? This is your get it done option. You'll get a full year of Confident Canine Care program plus the Optimum Training Tips ebook, a $40 bonus for just $299. Silver? Want a little more support and structure? For only $349, Silver gives you everything in bronze, plus the Keep Your Dog's Attention Tasty Treat Recipes, the Fridge Workout Calendar, access to the exercise community that allows you to see previous extra teachings and ask questions, and the Optimum exercise flashcard game. That's a $200 value in extras to keep learning fun and flexible. And then gold. Are you ready to jump all in? Gold is the full experience. You'll get everything from silver plus the Optimum physical fitness workout book and 7 live VIP coaching lab sessions with me. I'll personally answer all your questions on the exercises, review your videos, and give you feedback in group sessions, all for only $449. Class size is limited, and the ability to join closes on July 17th. After that, only bronze and silver will be available. So if you want that direct guidance and coaching from me, now is the time to jump in. Let's get started. Your patients and your pups will thank you. Still not sure if this course is for you? Let me share Kim's story. Dr. Laurie, you are the best. I love this course. I wasn't sure it would benefit me since I trained with you early in my career. But wow, I realized how much I had forgotten and how much I never knew. The course was laid out beautifully for beginners and old-timers alike. As always, your knowledge and the way you teach is exceptional. I would recommend this course to anyone. Kim and Journey. This course isn't just a review or a collection of exercises. It's a fresh, empowering way to deepen what you already know and adds tools that work right away in your practice. Still feeling unsure? That's okay. There's zero risk. We offer a 7-day satisfaction guarantee, and you can even keep all the printable bonuses because we want you to feel confident from the start. So if you're ready to learn the 24 exercises that can transform how you care for your dogs and your patients, click the link below and join us. Let's give every dog we know the chance at a longer, happier, pain-free life. Confident Canine Care gives you simple, effective exercises, tools you can use right away to reduce pain, build strength, and boost mobility in your patients. They're practical, easy to implement, and don't require rehab certification. Whether you're a vet or vet tech, you'll walk away with the real skills that you can start using tomorrow. No more waiting, no more guessing, just better care for every dog you treat. Click the link below to join us now. Have questions? Drop them in the chat. I'd love to help answer them before we wrap up. Confident Canine Care is truly one of my favorite things to teach, and I know you're going to love what it brings to your practice and your patients. Click the link below to get started now with therapeutic exercises you can use starting today. Still thinking it over? You can always reach me at dr.laurie@optimumpetvitality.com. Can't wait to see you inside Confident Canine Care.